We have 275 confirmed or plus confirmed positive cases of coronavirus in Arlington. 36 deaths as of this recording. It seems as though the curve is being flattened, but in reality, we have a heck of a way to go.
Yeah, I think that's right. Definitely the rate of growth has slowed, although there still has been some growth in younger populations or, in the younger population of people being tested positive. So, yeah, I mean, that is good news. But if you read the Globe this morning or last night or this morning, basically every expert interviewed is saying, what the governor is doing is smart and thoughtful and is, being done appropriately, but it's almost a sure thing that there will be another outbreak or a rise in cases as we start to interact with people again. So I think you're right. There's a long road ahead of us, and I think there's going to be a lot of caution. A lot of things are going to be different than they were before this all started. So there is good news. I mean, I don't want to be all down about it, but the reality is we have a long road ahead of us.
Well, the governor just released his stay at home basically became safer at home. So as of now, we have maybe construction in certain places of worship opened as of now with restrictions. But then we also have, I guess on the 25th, we're going to have barbershops, salons, retail with restrictions. How is that going to work in Arlington?
So really, we're going to spend this whole week, our health staff is going to spend this whole week going through all of those restrictions, all of those requirements, working with the establishments that would like to open on the 25th, and making sure it can be done safely. I think the easy one is curbside retail. Mm-hmm. We've been doing curbside takeout now for the past 8 weeks. I think that's very low risk, bringing people into a confined indoor space. So I think that one is going to be fairly easy. I mean, we'll still obviously want people to meet up with with the guidelines and requirements of the state. Personal care services, I think that one is very challenging. I think the restrictions that the state has put in place are appropriate, but very strict. So I really, over the course of this week, expect to learn more about whether or not the barbershops and salons in Arlington will have the will and ability to meet up with those requirements and restrictions. Because they're very serious. I mean, the types of partitions and physical separation and disinfection that are going to be required or are required are pretty serious. So we're going to continue to work through it. I mean, we want businesses to survive, so we want to be cooperative, but we also want to be cautious and not invite more trouble for ourselves.